From there, I went into managing health clubs, fitness clubs around the Gold Coast, up towards Brisbane and down in Tweed. And then went into some commercial fitness equipment sales statewide for companies like Nautilus and Cybex and Stairmaster for a couple of years. But basically I was a travelling salesman, so even though it was in the fitness industry, it wasn't something I was really keen on, so I had to reinvent myself and came out as a remedial massage therapist in 2011. Me and my kids, my son Cameron, he's 29, he's a mechanical engineer, he lives in Sydney, he got married last year to his lovely wife Kirsty. My daughter Hannah is a bit of a chip off the old block. She's a medical receptionist and an animator, and she lives near Brisbane and she's getting married next year. Okay. Sports experience, I've done a lot of work because of my background. I initially worked in sports clinics and with sports physios, so I did a lot of work with the NRL teams, mainly the teams that would come up here to play the Titans, some of the international rugby teams, AFL and state cricket, and did a fair bit of work with the Institute of Sport, who have a base here on the Gold Coast at Burleigh Waters, where their kayakers and triathletes train. So I did a lot of work with them, and also worked at the Commonwealth Games Village in 2018. A couple of pictures. I've done a lot of work with a group of Paralympians, Scott Reardon and I'm trying to remember her name, Vanessa Lowe. They're now a married couple, gold medalists, Paralympians. When you think you've had a tough day, Vanessa bounces into the room with a massive smile and promptly takes both of her legs off and jumps up on the table. You realise your day wasn't quite so difficult after all. That's me in the lovely Commonwealth Games costume they put us in, and with the kayakers out on Burleigh Waters. Okay, what is remedial massage? Okay, there are lots of different types of massage, so I'm technically a remedial massage, that's the phrase you're looking for, and it's the assessment and treatment of musculoskeletal dysfunctions that cause pain and restrict human movement. Okay. So the modalities that we use, deep tissue massage, that's a phrase that basically means we're not going to tickle you. This isn't, we will do relaxation if you're after it, but it's deep tissue. The idea is to do some work, but it's not to cause pain. Anita will tell you she's very keen on no pain when she's getting a massage. Trigger point therapy is working on those specific sore points that really do restrict your movement and give you pain whenever you're moving. So it's getting to work on those to try and help them release and relieve. I also dry needle, same needles as acupuncture, different approach. Some people love them, some people find needles a bit hard to stomach. Usually the guys, the girls are much tougher than the guys. But if you're needing those real stubborn areas, dry needling is a great way to affect change in those areas. Assisted stretching, I'm doing that more and more and more because we are getting tighter and tighter and tighter as people because we just don't move a great deal. So assisted stretching can be a big part of what we do. And relaxation, people just want to relax, that's fine, we can do that too. It doesn't have to be all thumbs and elbows. Okay. But the benefits of the remedial massage, pain relief obviously, to stimulate blood flow, that helps the body repair itself, which is really what we're trying to do. We're trying to help the body repair itself in a way, we're just aiding that process. Recovery from exercise, so that you can recover and go again. So you're not so sore after a workout that you can't train for the rest of the week. If people want to do regular exercise, stretching afterwards, warming up, warming down, but also something like massage is part of the process to help you keep going. Promotes healing and injury recovery, increase your range of motion and mobility, and that's probably one of the key ones. We get older, we get stiffer, we stop moving properly, we stop trying to move properly. So it's to try and get you back to a more fluid way of actually moving. Reduce muscle tension and stress, physical stress and mental stress. They really do go hand in hand. When you're feeling better, this works better. When this works better, your body tends to respond alongside. Improve posture. I'm a bit of a posture Nazi. I was prodded and poked. My father did a thing called Alexander technique when I was growing up, which is all about posture, and he was an athlete as well. So I wasn't allowed to slouch as a kid, which is good because I'm short. I can't afford to lose any inches. But posture is such a thing. is such a big deal. And obviously we're now creating a generation of hunchbacks with the young ones with this position almost constant, they can't open up. So it's a big part of what I do. I talk a lot to people about how your daily processes and work movements affect your posture on an ongoing basis, and try and see if there are ways we can improve that, from the driving position in your car, if you're in a car at all, your seated position at a desk, the type of chair you use, the way you set your desk up. So I do a lot of talk about that with people to see if they can start to help themselves a little bit more than they are doing. Improves your sleep, that's where you get your recovery and your overall well-being. Who recognises that? So musculoskeletal dysfunction usually results from poor posture, usually because of your occupation. No matter what you do, you have repetitive movements constantly. You know, it's not many people don't have a repetitive day in, day out. Obviously, the biggest enemy is sitting down all day, which the majority of us in the modern world do. So that's one of the biggest issues. Habitual and lifestyle patterns. We are habitual in the way that we move. We will repeat things without even knowing about it. We can become very one-sided without realizing that we are, until something starts to go wrong. And then we can work out, okay, do you always cross your legs the same way? Do you always dig a ditch the same way? Do you always use the same arms to do your plastering? Whatever it may be, we tend to not think about the way we move. Our body changes to compensate for those demands, and that leads to dysfunction. So why remedial massage? Basically, all those movements that we do shorten our muscle. When we get into dysfunction, sections of muscle fibers remain partially contracted. They shorten and they stay short. And then they start to track the muscle fibers around them. And that's where we get those, what we used to call knots, and what we now call trigger points, because they trigger issues elsewhere. So when it's shortened, that means that section of muscle just doesn't work properly. So you lose strength, you lose mobility. So shortened tissue is unable to perform normal function, as it is held in a contracted state, which impedes the body's ability to move efficiently. So basically what my job is to just try and lengthen you, is to try and lengthen everything, make you taller. Doesn't work on me, but posture goals, that's where we want to get you to. That's the obvious one that most people will recognize in themselves. Okay. Do you suffer from muscular discomfort, tension, aches, or sports injury? This is just the upper body. And I imagine most of you could point to at least two of those and say, that's an issue for me. Headaches and migraine, neck ache, whiplash, tendon problems, tennis elbow, RSI issues, which is a massive issue, RSI issues. I suffer myself. I've been down the cortisone route in elbows and wrists because of what I do. And if anybody's ever had that, they'll know how incredibly painful that can be. Sports injuries, shoulders, probably the biggest issue joint there is, because it's such a built for mobility, not stability. It's probably the number one joint I have to look after with people. Lower back, we'll always suffer from lower back issues and leg pain. So all those things we all suffer with at some point or other, and they're all things that I will help you address. Okay. We also often fall in, when we don't address things, we fall into a pain cycle. We get pain, and then we go into what we call muscle guarding, which basically means you start to move like a robot. You start to become frightened to do certain movements because of fear that you're going to put my back out or it's going to hurt. So we start walking around like this, and we lose that natural flow and natural way that we should be moving. So the idea is to try and improve that restricted range of movement that comes out of muscle guarding, to try and combat this. Because when we restrict our range of movement and we stop doing things, we stop using muscles. They atrophy, they disappear. So we gain muscle weakness. Atrophy is just the loss of muscle tissue. So we decrease our function, so we're less able to do stuff. You know, as we get older, we lose independence, and that's one of the main things we want to regain, is our independence to move. That can obviously lead to psychological stress as well as physical. So mind and body connect up. Okay, so we want to try and break that pain cycle. So the important bits. That's me and my lovely partner, Kes. I love my job. I'll come to you. I'm mobile, so I'll come to your home, your office. I can work in very small spaces, surprising the spaces that we can set up a table in. So that makes it easier for you. It's not such a big part of your life or your day taken out traveling to someone, getting changed, coming home, getting a shower, whatever it may be. You're at home or at your workplace. Flexible hours. I work Monday through Thursday. I'm pretty flexible. Health fund rebates. So I'm fully qualified. I have my insurances. I have my provider numbers. That's what a remedial massage therapist will get you, as opposed to just the standard therapeutic massage therapist that doesn't have that availability. So you can claim against my services. And I think the main driving message I always give to everybody is investing in yourself regularly. So massage for maintenance is the key phrase. And that's it. Anybody got any questions?
I'm going to use you. I mentioned something about my back 12
You can
months
use
ago.
me.
Okay. No, I promise I am, because it's going nowhere. But anyway, yeah, that'll be great.
I've
Melissa.
got a question. Do you watch the Winter Olympics